Welcome to the Why Did I Get Cancer podcast. I'm Deborah Herlax-Enos, a small town girl turned TV nutritionist and healthy living expert. I design health programs for the average guy or gal, including those average guys named Metallica. On September 1st, 2020, I was diagnosed with breast cancer. I asked every oncologist the same question, why did I get cancer? But none of my doctors had good answers for me. I wanted answers, and that's why I started this podcast. I want to help you to lower your cancer risk and provide self-care tips for those in the battle. I'm getting answers, and I want to share them with you. Welcome to part 2 of my interview with Dr. Corinne Menn, OBGYN, menopause expert, and 24-year breast cancer survivor. Today's episode, there's going to be a lot of takeaways for you. We talk a lot about sex. We do. We're talking about sex and more enjoyable sex as we get older. A lot of us are not having that. So we are committed to bring you information so that you can have that, especially post-cancer diagnosis when you're also doing a lot of additional therapies that are removing more estrogen from your body, things like tamoxifen. She covers a lot of bad studies out there, and there's some good takeaways from the studies, but some of the bad stuff is that women should never be doing hormones. She puts that myth to rest in this episode. We also talked a lot. Another takeaway that most women who have breast cancer don't actually die from breast cancer. They end up dying from heart disease. And a lot of it has to do with the issues they've had with cancer, meaning chemotherapy, radiation, estrogen deprivation for a really long time. And then without the estrogen, you're not sleeping and then you're gaining weight. So all of this can contribute to having heart disease and then actually dying from heart disease. So I highly recommend you go back and listen to part 1, listen to part 2. Dr. Corinne Menn is just a treasure, and she is full of wisdom, and she is really committed to helping women not to suffer during menopause, especially when you've got menopause going on and also cancer diagnosis. So hope you enjoy today's podcast. Boy, it was a real blessing to me. Enjoy. It's time to start paying attention. And there is a solution. I've been on a vaginal estrogen since probably 6 months into cancer treatment with surgeries, but I had to pay out of pocket to go to a naturopath oncologist. And so, so that's great. I have the money to pay for that. What about these women in lower socioeconomic areas who don't have, I'm in the health field. I was educated and I had money. So it worked out for me. But what about those women?
Yeah, so exactly. And so this is, again, not rocket science. It's pretty easy. Like, vaginal estrogen is safe. The nurse practitioner, the PA who's working with the oncologist, they could easily counsel and prescribe it. The average OBGYN does not need permission from the oncologist to prescribe something that is safe and effective. They can, of course, you want the health care team to all be on board and everybody be informed, yes. But what happens, I see, is this kind of cat and mouse game where the oncologist is like, go see your OBGYN about that. Then the OBGYN's like, well, I don't really know. You have ER-positive breast cancer. Why don't you just start with lube? And so then you go talk to your oncologist. And then they've got to wait 6 months to get in, and they're basically caught in a catch-22. And I'm like, wait, please stop the madness. Can we
please stop
address this?
Right.
So that's one example. But then we can also talk about, like, the impacts of hot flashes, night sweats, mood changes, joint pain, all of the other things, heart palpitations, brain fog, changes in mood, cognition. Those things need to be taken seriously. And they, listen, we would love to be able to say, like, hey, everybody go back on your HRT, and listen, that's a separate conversation about who can decide when they're done with treatment if they decide to use HRT. But even if we're not talking about systemic hormones, there's a whole list of things that women can do proactively to help manage all of these things that don't involve taking hormones. A lot of it is, as a nutritionist, you probably know this, right? A lot of it is really specific counseling about nutrition, really specific counseling about exercise. But telling a breast cancer survivor who's in the midst of it, just eat healthy and exercise more, it's not enough because it's too, like, broad. We need to be like, no, here's a prescription. I
Right.
need you to, these are the things you need to start eating. You need to exercise. You need to start strength training. You need to understand you're about to lose skeletal muscle and bone mass.
Yep.
And you need to understand you're going to start gaining visceral fat,
Yep.
and your metabolic rate is going to get lower because you're not sleeping, and the loss of estrogen drives all of these things. It's
Yep.
a metabolic kind of change
Perfect
that,
storm.
yeah. And, people are like, well, just give, well, if I don't have estrogen, I can't help that storm. That's not true.
Hmm.
Yes, having estrogen is very helpful, but if you can't have it due to your treatments, there are so many ways we can hit that storm proactively, but we
Yeah.
can't just tell women to just exercise and eat right without really good guidance. And the guidance isn't hard, but it needs to be written out like a prescription,
Yeah.
right?
Yeah, I can see how important that would be, because just telling somebody, well, go exercise a little bit more, do this, do that. Well, you're sleep deprived. You're getting up to pee 3 times a night. You're having 5 hot flashes.
Your
Exercising
joint-
more,
And your
y-
joints
y-
hurt. Well, that's the
your
other.
joints hurt, right? And your muscle recovery when you do work out isn't the same as it was 10 years ago. So, you're putting women at risk of more injuries, falls, like all these different things by just saying, okay, let's just go exercise a little bit more, add more cardio, add more of this. Well, how about we add more sleep?
Yeah.
Because
And
we can
really,
do other things.
yeah. And I think that, and I get it, like the oncologist doesn't necessarily have time to go through all of that, but what they need to do is, we really need to, if you're an oncologist listening to this, or you're a patient who wants your team to do more, you need to basically say, okay, I get it that you don't know the answer to this, but I know I've self-educated that this, breast cancer treatments are going to affect every aspect of my body. It's not just about my breast cancer recurrence. It's about everything. And I need a referral to someone who really knows how I can
Mhm.
maintain my skeletal muscle. I want to know, how can I best help my cardiovascular health, because breast cancer survivors are more likely to die of cardiovascular disease than their breast cancer. Breast cancer
What?
treatments, breast cancer treatments, well, because the majority of breast cancer survivors will survive their disease. And I'm not
Yeah.
minimizing the fact that there are women every year who die of breast
Mhm,
cancer.
of
Yes,
course. Hmm.
women do, and women develop stage 4 breast cancer, which is not curable. But the vast majority of women do not.
Hmm.
And so they go on to live a long life, perhaps, but their life might be shortened, and they're likely to die not of their breast cancer. Most early stage breast cancer patients are not dying of breast cancer.
Hmm.
They're eventually dying of cardiovascular disease. Like, is the number one killer of all women is cardiovascular disease.
Right.
Breast cancer survivors aren't informed that their cardiovascular risk is higher than the average woman.
Hmm.
Why? Mainly because of treatment side effects. So early menopause, major risk factor for
Yeah.
cardiovascular disease. Premature menopause prior to the age of 40, certainly 45, but certainly 40, or prolonged estrogen deprivation, very
Hmm.
negative on cardiovascular health. Aromatase inhibitors in particular are negative.
Yeah.
Chest wall radiation adds to that.
Mhm.
Herceptin adds to that. So if you take a Herceptin, anthracycline-based chemotherapy adds to that. Weight gain, depression, insomnia, severe vasomotor symptoms all seem to be associated with worse cardiovascular things. So when you take that all together, you can see it's like another perfect storm. Now,
Right.
it doesn't mean that if you don't have estrogen, we can't help that storm, but we better be a little bit more proactive. And so when I ask my breast cancer survivors who come to my educational sessions, or I have, they see me as a patient, I ask them, so has anyone looked at your cardiac health? Do you know your cholesterol? Oh, they did it a year or so ago. It's fine. Like, there's no one's really
Hmm.
doing a holistic look at what is her. And, I say, has anyone done a bone density? I am shocked that the minority of patients, and this is shocking because this is part of, it should be the care. They're not even looking at their bone health. They're like, oh, my doctor just told me to take vitamin D and get a little exercise, and they'll just keep an eye on it. And I'm like, you're 34. You have severe estrogen deprivation. You are at very high risk of
Right.
osteoporosis.
Right.
And so if we can't give you back estrogen, we know we can at the very least be very proactive about your exercise and your nutrition.
Hmm.
we can also offer you, there are medications, right?
Mhm.
Bone specific medications to prevent further loss, but we
Right.
can't just sit on our butts and wait until 10 years that you present with an osteoporotic fracture,
Right.
because we know after a hip fracture, a third of women will be dead in the year after a hip
Yep.
fracture.
Yep.
And it's very debilitating. So we
Mm.
have to think a little bit more holistically about the long-term implications for these cancer survivors. So, we mentioned heart health, we mentioned bone health, we got into the sexual health part of it. The musculoskeletal syndrome of menopause
Mhm.
is something that Dr. Von der Wright just published an article on. She's an amazing orthopedic surgeon, and kind of just demonstrating through her review of the literature of that there is this syndrome that happens with the loss of estrogen. So guess what? Breast cancer survivors get the musculoskeletal syndrome of menopause earlier and in a more profound
Oh
way.
my goodness.
And so that syndrome is muscle loss, and bone
Mm.
loss, and the impact on joints,
Yep.
right?
And metabolism and all the things. Yeah.
Yeah. And so this is why you can't just be like, yeah, like hot flashes and a little vaginal dryness. Like, so coconut oil and an antidepressant are not going to fix the things that I just mentioned, right?
Right. Right.
Which can seem overwhelming, but if you break them down in a logical way, we actually have actionable things we can do for all of those scenarios, right? You
Right.
don't have to feel overwhelmed, because when you listen to this podcast, you might feel overwhelmed by all of those things. But I'm here to say, no, we can break them down and we
Mhm.
can offer solutions, but it's not
Right.
happening.
And these are not just solutions for women who've had breast cancer.
Yeah.
I'm in a book club and it's all women. And maybe a year ago I said something about my estrogen ring, which I'm sure my
Love it. Yeah.
form of vaginal estrogen that my naturopath oncologist prescribed for me. And there were 10 women there and only one had ever heard of it. And
Well,
I
this is
said,
exactly right. Yes.
this will change your life. Like, ask next time, you call your doctor or go into the portal, please ask about this. If you want to, not experience dryness in the vagina, sex doesn't hurt anymore. I haven't
Very.
had a bladder infection or urinary tract infection in forever. And it's really, for me, made a huge difference. And it made me so sad that none of these women had ever heard about it. And they kept saying, but you had cancer, you had cancer. And for me trying to explain, yes, but it's vaginal. There's great research. It's okay.
It is okay. And so you can put it in your resource link for this, but I actually, because I'm so tired of patients and women telling me like, no, but cancer. I said, no. We have lots of guidance. So I made a Google document and I just keep it updated. And every time a new study
Great.
goes on, I add it. And it's literally, when you look at it, I tell patients, take this, print it out. And if you want to go as far, print out every link in here. You will have an entire library. Plop it on your oncologist's desk or your OBGYN's desk and say, I'm not leaving today without a prescription for vaginal estrogen, because if this amount of data and published literature is not enough for you, then I don't know what else to say, right? Because this is from ASCO, Menopause Society, OBGYN Society, in every, these are journal articles, literature that is peer reviewed, and we have decades of data on this. It is no longer acceptable to be telling breast cancer survivors they can't use local vaginal hormones.
Yeah.
So please share that link, because,
I will. Yes.
patients really, I think when a doctor is presented with like, oh, okay, here's a document with like all these studies, it's like, it's actually embarrassing for them to say no. And if they still say no, then that's your sign you need a new doctor.
You need a new doctor. You need a new team. And Dr. Menn, it seems like we've demonized the word hormone. Does hormone equal malpractice? Does hormone equal lawsuit? Is this why doctors are so hung up on not prescribing? All right, now that the hustle and bustle of the holidays is behind us, I got to tell you, it's when I really start to take a look at some of the things that I'm doing for my health and what can I do to just make some little changes. And This year, for the month of January, I'm going to really stay focused on making changes in my kitchen. If I think about changing my whole house, what I'm doing for my beauty and bathroom and bedding and all of that, it's a little too overwhelming. So for the month of January, I'm focused on my kitchen. I have to tell you, there's some kitchen gadgets I changed out when I got diagnosed with cancer, from something as simple as no more plastic cutting boards, because every time you cut into those plastic cutting boards, you are releasing plastic into your food, microplastics that are then going into your food and into your body. When you have those plastics in your body, it disrupts your hormones. It can cause inflammation, and it's basically impossible to get out. So I don't want that. We're already ingesting about a credit card size of plastic daily in the habits that we do, the water we drink, the air that we breathe. So, and that is based on some information from Dr. Lee Aaron Keneally from the Center for New Medicine. So all that to say, if you're interested in seeing what I'm doing to detox my kitchen in January, I have a new Amazon store, and I have all of my products listed there that I'm just doing some simple swaps. Some are very inexpensive, like under $10 swaps, probably even under $5 swaps. So I highly encourage you, go to the show notes, go to my Amazon page, and you're going to see just, again, the simple things that I'm doing. I don't want to be overwhelmed with changes in the new year. And I really hope that this ends up just being a good blessing to you, and pass it on to your friends who are also looking for ways to detox. Enjoy.
Yes. Listen, as an OBGYN, I'm really very aware and cognizant of the fear of medical malpractice, because as OBGYNs, we're amongst the most sued physicians of all the specialties.
Yep.
And as an example, I tell this because it's a shock value, right? I practice in New York State. When I was doing full-time OBGYN, and I never had a lawsuit against me, and this was years ago when I was still doing obstetrical deliveries, right? For me to just walk in the door, I had to obviously have medical malpractice. My medical malpractice for OBGYN was $125,000 per year for me. So I had to pay $125,000 to an insurance company before I paid for any other expense, right? One malpractice suit, obviously, you have your malpractice coverage, but that one malpractice suit could drag you through years of court cases, something on your record, it's very stressful. So doctors are extremely, fearful of lawsuits.
Yeah.
So when we have this world where we have now a breast cancer survivor who is asking for hormones, God forbid, for her vagina, honestly, the knee-jerk reaction is medical malpractice fear.
Yeah, I can understand that.
And that comes from the Women's Health Initiative from 2002, which created a lot of misinformation. And we learned a lot of good things. I don't like to totally vilify that study, because the Women's Health Initiative was a gazillion-dollar study, and we learned a lot of important things. The problem was it was mismessaged by the media. And
what a surprise.
And it was misinterpreted by the primary investigators. And that's a whole nother discussion. But it is what it is. But what it did is it vilified hormone therapy for the average menopausal women, and basically made everybody think it caused breast cancer and heart disease, which actually couldn't be further from the truth in either accounts, which that's a whole separate discussion. Now we've come full circle, and we know now, we've got very clear guidelines that we can't just use that mismessaging to counsel patients. And we know that the data is, for the vast majority of women, hormone therapy, the benefits far outweigh the risks for the average menopausal woman, right? But that fear that created this legacy of fear about the word estrogen, and it vilified it. It made it a dirty word. And so you take that, and then, you add on top of that for ER positive breast cancer, we do use anti-estrogens. We use tamoxifen, we use aromatase inhibitors. So that creates confusion. Well, if we're blocking receptors, estrogen must be bad, right?
Right.
And so I understand why people get confused by that. It's understandable, right?
Yeah.
But there's a little bit more nuance to that we have to explain to patients. But I think those things have made estrogen seem like a dirty word, and it shouldn't be. It's made women fear something that their bodies make and serve us very well through our years, right? Without estrogen,
Right.
we couldn't have babies, we couldn't have breasts, we wouldn't develop as grown adult women, right? It's an important hormone, and testosterone is an important hormone too. It's a female hormone, but we've created a lot of fear around that, right?
Yeah, a lot of fear. And then it's just an easy default to think, well, I heard blah, blah, blah. And as you said,
Which is bad, yeah.
we're giving women all these drugs to to suppress that block estrogen. So, I can see how the conclusion would be so easily drawn that, well, why would I use that if I'm already taking this?
Yes.
It
Well,
just
so,
it
yeah,
makes
and I think
sense.
so. Two like super simple points that I think it's really important for people to understand. One is estrogen receptor positive breast cancer. Okay, that's about
Hmm.
80% of the breast cancer that is diagnosed.
Hmm.
Um, Good news is estrogen receptor positive breast cancer tends to have a better prognosis, right? And generally is slower growing. But part of the treatment modality is to target those estrogen receptors. So people think that estrogen caused their breast cancer if they have ER positive breast cancer. So let's
Hmm.
just make this super clear. All normal breast cells have estrogen receptors. There are estrogen receptors on every cell of your body, from your brain to your gut, your bones, your muscles, and yes, your breasts, your bladder, everywhere else.
Yeah.
So that's in a normal, healthy breast cell. Okay. So, your 12-year-old daughter has estrogen receptors on her breasts, right?
Hmm.
So when you get estrogen receptor positive breast cancer, what that means is that your breast cancer, those cells developed, and for whatever reason, you got cancer, they became cancerous, and they still have the estrogen receptor on them. Okay. So they
Hmm.
kind of retain that estrogen receptor.
Right.
Estrogen receptor negative patients, right? Their normal healthy breast cells have estrogen receptors on it. When their cancer developed, their breast cancer, those cells basically don't express the estrogen receptor anymore. Those
Hmm.
cells tend to be ER negative breast cancer tends to be more aggressive. We call it often triple negative breast cancer. If they're also HER2 negative, tend to be rapidly growing, and they don't
Okay.
respond to manipulating the receptor. So I want women who have ER positive breast cancer to understand estrogen didn't cause your breast cancer just because it's ER positive.
Hmm.
But your cancer has estrogen receptors. So that's one way that your oncologist has a strategy to manipulate those cancer cells to do something to keep them from growing. And we manipulate cancer cells in a lot of ways, right? We give it chemo, we cut it out, we radiate it, so we burn it
Hmm.
out.
Yeah.
We can block receptors, whether it's ER receptors or if you carry the HER2 new overexpression, we can manipulate it with Herceptin. There's also these other things, we're doing now, immunotherapy. There's all these other new medications. So there's lots of ways we're manipulating it. And just because
Hmm.
it expresses the estrogen receptor does not mean that estrogen caused your breast cancer, number one.
Okay.
And
Hmm.
number two, women have to understand the difference between systemic hormone therapy and vaginal hormone therapy, two
Yeah.
totally different things. And I,
Yeah.
I did a reel recently where I said it's like you take Benadryl pill, right?
Hmm.
That you take as a pill and it makes you sleepy. And if you have a big allergic reaction in your body, it's going to help you, right? But you also can use a Benadryl cream, right?
Oh, yes.
That's the same thing. Or you take a prednisone, is a steroid pill that helps for lots of things, right? We use
Hmm.
steroids systemically, but we also over the counter get cortisone cream. That's a steroid cream.
Yeah.
And that's just topical. So it's like there's HRT, so systemic estrogen pills, patches, gels that are
Hmm.
FDA approved for hot flashes,
Yeah.
osteoporosis protection. That's very different from giving a little local vaginal estrogen cream. So that's how you have,
Great analogy. That
right?
is a great, and that's going to help me to explain it to girlfriends who
Yeah.
say, but you can't do estrogen or you can't.
No,
I
so
love
it's like
that. Yeah.
it's skincare. I say vaginal estrogen is skincare for down there, right? So it's
Hmm.
protecting the skin of vulva, vagina, but also the urethral kind of skin and the skin inside the bladder. And it's
Right.
staying where we apply it. It's staying
Yeah.
locally. So
Huh.
this is why it's safe, even if you have, breast cancer that you're being treated with tamoxifen risk blocking receptors or with an aromatase inhibitor, which lowers your systemic level of estrogen.
Yeah.
But you can still give back a little local level of estrogen just to where you're having the discomfort or the symptoms.
Right. And it will change your life
It'll
in
change
so
your
many
life.
ways. It'll
Oh,
change your
yeah.
life. So As we're wrapping up, I know you're a 24-year breast cancer survivor. Uh, what advice would you have given the 30-year-old Dr. Menn?
Yeah. So, first of all, I did not do breast cancer survivorship well for many years because I was not educated myself. So, if I had to
Mm,
look back at my young self, I would have told her to take a deep breath and understand that the lifestyle pillars of health apply more to you than ever before, and that
mm,
you have to make time out of your schedule and you have to advocate for yourself with your doctors about how you can implement nutrition, exercise, stress reduction, emotional health. That has to be prioritized.
mm,
And it's just as important as your chemotherapy and as your cancer treatment. So when looking
mm,
back, I was just, treading water and barely surviving, and I didn't make
yeah.
any time. So I really wish I would have doubled down on those things, right? Number one.
Mm.
And then the other thing is we've come a long way, baby, in 24 years. And
Definitely.
we have so many evidence-based solutions for dealing with menopause, sexual health, long-term survivorship care. And but I and we they exist, but nobody's coming to save you is what I'm going to tell you as well.
Mm,
And so you need to save yourself. And so you have to be the CEO of your survivorship, and your survivorship starts on day 1 of your diagnosis. So I know it's a big burden to ask you to have to self-educate, but honey, you got to self-educate
me
because I'm
too.
sorry, the medical community, we're catching up, but it's going to take a long time to teach old dogs new tricks. So what
Hmm.
do? You have to self-educate because an educated patient who goes in with the right questions is going to be the one who gets care. Where do you get that education?
Mm,
You can follow me. I've got lots of resources. A great source of information is menopauseandcancer.org. It's a nonprofit out of the UK, which has tremendous help for cancer survivors, all types, not just breast cancer survivors, on full survivorship care, including menopause and sexual health. I think that's one of my top sources of information.
mm,
Um, and start to plug in to, these resources because, and keep a list of what is something that is bothering you that you want to work on. And I promise you, if we chip away at each little thing, we'll finally get to a place where you feel whole again. And we may not fix everything at once, but we can start to tackle all of your survivorship concerns, and nothing, you shouldn't
mm.
make light of any of it. It's all important, right?
I love that, that you don't have to make light of any of it.
Yeah.
It's all important, and you're right. And it's okay to raise your hand and ask for help.
Yeah. And
And
you can
that's
say,
yeah.
listen, I respectfully understand, doctor, that you may not know about this, but I'm
Hmm.
also going to ask you for shared decision making and that this is important for me. It's as equally important as my breast cancer treatment. So if you don't know how to help my really serious sexual dysfunction that's been happened because of cancer treatments, then I'm sorry. I think you have a real medical responsibility to refer me to a qualified person who can help me. And there are qualified people out there.
Hmm.
There's incredible sex therapists, there's pelvic floor physical therapists, there's sexual medicine trained physicians, there's menopause specialists, there's nutritionists, there's, exercise specialists who know how to help me. There's so many ways. So, doctor, can you get yourself, a little referral network so that you can send me off? And if not,
Hmm.
I'm going to have to find it myself, but I want you to be part of this team because,
Yeah.
you know, I want you to treat the whole person here.
Great advice. I'm 4 years post, and I'm realizing I could have done a lot better, and I still can today. And it's never too late because I'm still experiencing symptoms. And
Yeah.
I think as women, we just get used to the symptoms, and we just get used to soldiering on. And we don't have to, because there's good research, there's good data, and there's people like you who are out there publishing Google documents with all of the research that we
Yeah.
can then take to our oncology team or just a regular,
Yeah.
GP and
Yeah.
get some help.
Yeah.
Yeah.
And even when it comes to hormone therapy after breast cancer, this is a discussion that there's a percentage of breast cancer survivors who want to have that discussion. They are
Yeah.
grown ass women who can make informed decisions for themselves. And there is actually data and research that for some patients, it may be an option after
Yep.
you've completed your treatment. And
Yep.
just like we offer pregnancy, options and fertility preservation for breast cancer survivors, because we value a woman's reproductive capacity after breast cancer. Think about that.
Yeah.
Let that sink in. Right now, New England Journal of Medicine, just a year ago, published a very, very important study, kind of really cementing the safety of pregnancy after breast cancer. And women can pause their tamoxifen or their aromatherapy or adjuvant endocrine therapy for up to 2 years to get pregnant, have IVF. So we value that, we allow it, we support it and celebrate it. But God forbid a long-term survivor wants vaginal estrogen or a small dose of an estrogen patch and progesterone, and suddenly it's heresy to bring it up. Give me a break. But I say we value a woman for her reproductive capacity, but we are not valuing survivors in their long-term sexual health and quality of life.
Right.
So we'll let you be a vessel for a baby, but we won't give you
let you have an orgasm. Yeah.
Give me a break.
Right.
Now that's really where I really lose it.
Yeah, I really lose it there too. Yeah. Let's look at the whole picture, not just can you pop out a kid. So yeah. Okay, Dr. Menn, how does the whole world find you? Because we all need a Dr. Menn in our life.
So you could follow me on Instagram, where I post a lot of information, Dr. Menn, OBGYN, a lot of information about general menopause as well as breast cancer survivorship, number one. And the link in the bio there has a reference to that article on vaginal estrogen. I also teach a course for doctors who want to learn how to deal with menopause, hormone therapy questions, and in breast cancer survivors. And in a couple of weeks, I'm launching a course for the breast cancer survivor who just wants to kind of take this information in a more structured way so that they can be self-educated and advocate with their doctors. So look out for that.
Oh, I cannot wait for that.
Yeah. And I'm a medical advisor and a doctor for Alloy, which is a menopause telehealth platform for women. So it's great access for women who are looking for, menopause specialists to help them with their hormone therapy decision and options. And we do offer access to vaginal estrogen for breast cancer survivors and non-hormonal options for them as well. So that's a great source to check out.
And that's virtual. And so anybody
online clinic, and we've got doctors, me and my colleagues, we're in all 50 states. So whether it's me or with one of my really excellent OBGYN menopause specialist colleagues, it's a great source for general menopause care and access to hormone therapy for women who are
that's great. I wish I would have known you 4 years ago, but I know you now, and you're changing lives and bringing the specialness back to life because you're looking at the whole woman. And that just means so much to me. So thanks for sharing your wisdom. This was such a great recording. I cannot wait to go back and listen to it again. And thanks for joining me on Why Did I Get Cancer?
Well, thank you for having me and spreading the word and giving a platform for women to learn more.
Yes. Thank you, Dr. Menn. Happy 2025, everybody, and happy healthier eating in 2025. And, it's the time of year where everybody says, I'm going to do this and I'm going to do that. So let's make it simple. And one of my goals in 2025 is to eat more fish. There's a lot of reasons for that. Higher levels of anti-inflammatory nutrients, including a lot of really good omega-3 fatty acids. I had never really been a good fish preparer at home. So I would usually just eat fish when I go to a restaurant. But I got to tell you, I have got a wonderful salmon recipe that I got from a chef. I'm going to tag it in the show notes. But here's the other thing is I want to eat wild caught Alaskan salmon. And it's not easy to find. And then what I also discovered is that wild Alaskan salmon in supermarkets is double frozen. So it's frozen on the ship when it's caught, and then it's defrosted, and then it's frozen again. When I found that out, I was really upset and irritated because when you freeze and unfreeze, the nutrient content is going to change. So I asked my contacts at ButcherBox, they freeze the fish one time. That is it. What that means is it's going to be a higher nutrient content and the texture is going to be better when you cook it. So I think maybe I'll just blame my bad fishing techniques, my bad cooking of the fish techniques on the fact that it was frozen twice. So can I just do that? But anyway, back to ButcherBox. In my show notes, you will see a great deal from ButcherBox for my community. And what it is it's $20 off of your first box, but it's free wild Alaskan sockeye salmon for a year in every box. And it's a $422 value. So I get free fish for a year. It's over a $400 value. That's a pretty amazing thing. So if you go to butcherbox.com/Enos, you're going to see this great deal. It's probably not going to last very long because that is a lot of free fish to be giving away. So again, my New Year's resolution, which I don't make very often, is to eat more fish in 2025. I'm trying to do this twice a week, so come and join me. Hey y'all, can you do me a favor today and go and leave a review of this podcast? I know that the more great reviews, wink, wink, emphasis on great, reviews that I get, along with more downloads and more subscribers, that pushes this podcast out to people who might normally not even find it. And the reason I started this podcast and my real heart for starting this podcast is that I needed this information. It wasn't available. And so I started a podcast so that I could be a blessing to others. So you're a blessing to me just by being here. And again, thank you for your support. Thank you for your positive reviews and all of the notes that you send me. And also just wanted to say, hey, keep in mind, I'm not a doctor. And if you need medical advice, please reach out to your team. That is going to be just the best source for you because they know you. So again, I hope you enjoyed this podcast.